issues yesterday.
That's all right. No need for apology. You're taking care of our city.
So what just happened?
I think Susan put the flag visual up. Maybe.
Are we supposed to salute it?
There you all are again. Okay, I think we are all on now. Except we lost the mayor. We'll wait for him.
Gotta love Homer's headset. Oh my gosh.
Mayor, I think we've got you muted again.
Purpose. Is that better?
There we go.
I had
think
pizza at
we are-
the door.
What's that?
I had pizza at the door.
Oh,
I'm just kidding.
I think we're ready to roll. I think you've got your full council here. Dr. Katz is on. I'm going to reach out to Dr. Landers and Dr. Howell to see if I could get a hold of them, because I hate to put all of this on Dr. Katz, but if nothing else, I think the conversation could go ahead and get started with what she's seeing locally and her thoughts on coronavirus here in Kansas.
All right. I'd like that very much.
I guess I'll just kind of tell you guys a little bit about what we've seen and what we're doing here locally. I work at the Ascension Medical Group here in Andover, right on Andover Road. And locally, we've seen an uptick in cases definitely in Sedgwick County and Butler County as well, obviously, although fewer cases in Sedgwick County in the last few weeks. And we do expect that number to continue to rise as we do more testing. Right now, testing is very limited to basically hospitalized patients, healthcare personnel that need to get back to work quickly if they are negative, or those that are maybe over 65 and have comorbid conditions that are at higher risk. But everybody else is basically being told to self-quarantine and not really getting tested. So the true numbers are, I would say, vastly underestimated for sure.
And so I think tonight when we sent out your meeting packet, we were really thinking and Dr. Landers has joined us too. So I guess that before I talk, I'll let Dr. Landers give her thoughts on what she's seeing local too. And we've got you muted on the front end, Dr. Landers, so you'll want to unmute yourself in the bottom left-hand corner.
Just learning. Is that better?
Yep, we can hear you.
All right. Sorry for being late. I guess on the local note, I would say that just within our office, we have not had any positive testing. We're probably running about 3 to 5 tests a day. And we've had a lot more symptomatic patients in the last 5 days, I would say, that we're just encouraging to self-isolate, not necessarily bringing in to test. Is that what you're seeing, Tara?
Yeah, pretty similar. We've had one positive confirmed in our office. So
Okay. We have still about a 7-day turnaround, unfortunately, so it's been challenging to get anything too quickly.
Tara,
sure.
when you say in our office, do you mean in Andover?
Yes, our office is in Andover.
Okay. So does anyone have a potential count of the number of cases in, I guess, Andover and/or Butler County?
I mean, again, I haven't seen any. It sounds like Tara has seen one within Andover. Was that patient living in Andover? Do you know?
they were a Sedgwick County case. Last I looked, there was 3, but that was this morning. I'm not sure if there's been another one, but Butler County had 3 last time I looked. But again, a lot of our population comes from Sedgwick County as well to our clinic here in town.
Yeah, that's us also.
I did just pull the numbers. So as of like 5 minutes ago, there were 3 Butler County, 49 Sedgwick County, 368 in the state, and 8 deaths per KDHE.
So far, none in Andover.
Sounds
So
right.
far, none tested and confirmed.
Right. Yeah. If you assume based on symptoms, I would say we're probably, I mean, I know on any given Monday, my staff is taking up to 40 phone calls from patients that are symptomatic that we're encouraging to stay home and self-isolate. So it's not a very accurate number based on testing.
How many are we actually testing? Do we have any idea?
Mr. Mayor, I can actually say that from the EMA report that I get every day, they showed 70 some odd negative tests so far in Butler County. So I don't know how many we're testing a day, but we've had, like
I would say
both
that's pretty-
doctors shared, it takes a while to get the tests back.
Yeah.
Sure.
I'd say that 70 is pretty accurate.
Mr. Mayor and Jenny, if I may, could I ask the doctors a question?
Absolutely.
Doctors, one of the things, I'm Chad Russell, I'm your fire chief. One of the things that increases my plan to the next level is when we decide that we've got, however you want to define community spread. So we're typically a first response agency and a tiered EMS service, but the plan includes pulling back from a lot of those responses if they're not decided to be critical calls from the dispatch information. And the trigger for that would be when we're in community spread, so I can preserve the fire staff to still make fire calls.
Sure.
I'm trying to walk the fine line between using up our short supply of PPE when we don't really need to and saving it for later, and making the right call when to pull that trigger. Do either of you have any advice for me tonight?
When you say PPE, are you talking specifically about N95 masks or just surgical masks?
Both, actually. We have a few more N95s than we do surgicals, but at our current burn rate, we have about 2.5, 3 weeks supply.
Okay. I mean, I will tell you right now, we are placing surgical masks on any patients that come in with cough and fever. The providers themselves are not wearing them regularly. We just haven't seen the need for that. My understanding with the virus is that unless a patient is very symptomatic with an active cough and a high fever, your risk of contagion is lower. So that being said, I don't know that the responders necessarily need to go in with masks for an asymptomatic patient.
Okay, and we are not.
Okay.
Just for clarification, we would decide that they have met what the CDC releases COVID-19 criteria, or that they appear to be symptomatic to us for some reason before we would do that. And actually with this tiered system, if we have an ambulance in the city, we're standing outside. We're not even going in the house until EMS goes and checks with them. And then even if we go inside, we're trying to send one out of the 2 crew members to try to limit those exposures a lot. But I'm really concerned that as we get more community spread, we're going to have so many folks that have COVID-19 that may not know it or may be mildly symptomatic, and we're dealing with them in some other way, even other than a medical call. And I start losing part of my 5 team members that I have for the day.
Sure.
So I'm trying to walk that line. I don't want to suggest to the council that we should reduce services until we absolutely have to. But at some point, the risk of exposure becomes so much that I don't have people to backfill the firefighters. So I have to keep them as healthy as I can for as long as I can. So I'm trying to decide when to pull that trigger.
I don't have a win number for you, but I would say this, that we had the patient that was positive in our office was actually diagnosed on a Monday. We actually saw her Friday for something completely different. She was asymptomatic, but probably shedding the virus from what we know. She started showing symptoms on Sunday, high fever. So we saw her Friday. And the entire clinic was, well, at least the providers, the roomers, those people were exposed, the front desk staff, because she was not given a mask because she wasn't having symptoms. So I think the tough part is it's hard for us to gauge how much community spread there is because there is such a lack in testing. But like Dr. Landers said, like our office is getting multiple calls every day, and we're just telling people, you know, yes, your symptoms are consistent, but you don't meet criteria. You need to stay home. So, I mean, I'm hesitant to say you need to do it now, but I definitely feel like there is community cases here now,
Oh,
although
absolutely.
in large numbers yet.
Yeah, I would agree with that.
So this is a pretty pretty large subject, I guess, for us to be talking about. What is the trigger for the fire department to quit making calls that are outside of the purview, I guess, of a fire? Is there any kind of normal direction for that kind of thing in an emergency situation like this? Is there other fire departments or larger fire departments or guidance from anyone anywhere on this? Or is this just going to be us flying a little bit by the seat of our pants to try to figure out this or make up our own line? Does that make sense?
Yeah, there's no guidance that I know. Well, I'll answer that 2 ways. There's no guidance that I know of, and there's plenty of other examples. The examples range from we're not going to do anything, including wearing no masks, all the way to we've stopped responding to medical calls altogether. We're in uncharted territory here. H1N1 in 2009, we didn't really respond this way as a fire department community. It was a different virus, but we're in uncharted territory. There's no example that I have in the history of the fire service to be able to look at to see what we've done in the past and how it worked.
What are resources for getting more masks?
They're close to non-existent. I made an order 3 weeks ago and I haven't seen any. The state is telling us that they actually did start sending a few orders out, a few partial orders. 2 days ago, I think Butler County got a few supplies, but I'm going off the premise that we're not getting any more supplies. And which means we have what we have. And when we're out of that, then we could always go to air packs if we feel like that's necessary. But then a 30-minute call ends up taking 2 hours because the decon is just really labor intensive and equipment intensive when you're deconning air packs.
This is a very scary situation overall for the fire department, I think, to be in. We got to figure out if you don't go to any calls at all now, none except for the fire calls, will people die? Right? I mean, that's the real question. If people are having cardiac arrest or have drowned in their bathtub or whatever, and you're able to get there before the paramedics are, you're saving them, which has happened a few times since I've been on the council. So I guess the question is, I don't know what the question is, honestly. It's like, okay, what is this line that we have to really think about where we say stop to the fire department, quit going on these calls? It doesn't sound like the masks are necessarily, I mean, the masks don't really protect you as much as if you were to shove that mask onto a person with the virus, is my understanding. And that's what I think Lindsay said earlier. And that's everything I've read. I don't know. Would Ronnie, what do you think about this? Or
Chief Russell, can I ask you a quick question?
Certainly.
So you kind of talked about changing the way the fire department works to accommodate what's going on. Is there middle tier? So the first one would be not doing anything differently. The final one would be not responding to the medical calls. Are there things that we can do that are sort of maybe in the middle as we move forward?
Yes, I didn't want to interrupt Councilman Tabor, and even if I wanted to, I didn't know how on video. So just for clarity, I'm not suggesting that we stop running medical calls altogether.
All right.
However, what I am suggesting is we're still responding as normal now. The next step would be that we stop responding to Alpha and Bravo calls. So we continue to go to Charlie, Delta, and Echo. And for those of you who are not aware, when the 911 dispatcher takes the call, they risk stratify the call, Omega and Alpha being the least severe, Echo being a patient that is not breathing or does not have a pulse. And then so it goes Alpha, Bravo, Charlie, Delta, Echo. So my suggestion and my advice to you is at some point we need to stop running Alpha and Bravo calls. And then another tier after that, we could even stop running Charlie calls.
I guess I had thought we had already quit running Alpha and Bravo calls before. Did you?
So we still run all medical calls except Alpha and Bravo calls that are at the nursing facilities where they already have staff.
Okay.
I don't know that this is helpful, but Troy, kind of what you're suggesting all of this goes into is in essence what's in the continuation of operation plan in terms of the devolution appendix. And so that is like the doomsday situation from the city perspective, in that we don't have the personnel to do the things we need to do. It's the point where we say, Sedgwick County Fire, we need you to take care of fire because we don't have the personnel to do it, or whatever area that may be. City of Augusta, we need you to take over the wastewater operation because we need the wastewater plant to continue to function, but all the operators have corona and are unable to come in and work. And so tomorrow night and we'll talk about it maybe a little bit more tonight, but that is the purpose of that document, is to have those essential city functions, because there are some that we provide that simply must go on. And the doomsday worst case scenario is if this continues to impact us in such a way that none of us on staff can do it, who are we going to hand those authorities over to in order to make sure we still serve our citizens to the best of our ability?
One thing to keep in mind is when the firemen go in, it's not a doctor's office that is prepared and cleaned. So when the person comes in, if you just put a mask on them, it's fine, because the office is not contaminated as a home might be when Chief Russell or one of his men go in. So that's a different scenario, not a lab that's generally clean anyway. So
Are we
that's
going
one-
to have, sorry to interrupt, are we going to have the same concern with paramedic staffing? Where does that pool come from?
They're from Butler County EMS, and docs, you've both watched this as it becomes more community spread, and it just envelops the community. Then we stop even quarantining healthcare workers, so we put it back to work. So yeah, we'll probably, I can't really speak for Butler County EMS, but I would think they're going to have the same staffing issues that I'm going to have until we stop quarantining the healthcare workers and send them back.
What is the sense? I know I've pretty well stayed in I've been hearing a lot of talk of quite a bit of activity in the parks and city areas. Can you tell me, is that pretty well dampened down as far as people being out with this nice weather?
So yesterday, Council President Troy Tabor and Mayor Price met with some staff on Zoom and gave direction to go ahead and shut down the playgrounds. We were really hoping to get direction from KDHE or CDC, and that has just never come specific to playgrounds. But in an abundance of caution, we went ahead and put snow fence around all of the playground areas today. And ironically, or as you would expect, that happened to be the primary topic on the Kansas Association of City Managers listserv today, was emails flying around about shutting down playgrounds today.
I think that's great. I mean, I think the more we can prevent is going to be, unfortunately, the only solution, really.
But to be clear, the parks are not closed. So if people want to go walking their dog or going for a walk,
Well, certainly, yeah.
certainly they're open. Just the playground equipment where it's metal or plastic or whatever, where the virus might live for a while.
Did we shut the bathrooms down too?
The issue with the bathroom in Central Park is that is also a tornado shelter. And so we discussed the fact that if you have a tornado barreling down on you and you have been taught over education and time that that's where a safe place you can go to avoid that tornado, that public health risk is more imminent than perhaps getting coronavirus. So at this time, those are still open.
And I think that's fair. I mean, I think everyone understands the risks if they use public facilities at this point. So hopefully the education is out there.
If it's a tornado or the virus, it's not a hard decision to make as a citizen that you take your chances with getting a virus, not getting sucked up in a tornado, and Andover knows that all too well, right?
Absolutely.
So do you Dr. Katz or Dr. Landers, do you have any idea of when you're in that loop more than we are, of course, when this might peak or what the spike might be, or any information to that level?
I can't see if Tara's still here.
Yeah.
Oh, hi. I mean, I would say in the next 7 to 10 days, I wouldn't say a peak. I would say that Kansas in general is doing very, very well with flattening the curve, as they say. So I would say the entire month of April, we're really at risk still.
Yeah, and I think that the information we're getting through the International Association of Fire Chiefs echoes what Dr. Landers said. The entire month of April, we plan on, from the fire department's perspective, we plan on an increase of cases through the entire month.
Any more questions?
Mr. Mayor, I have a question for either Dr. Landers or Dr. Katz. I'm Mike Keller, the police chief here in Andover, and we have similar concerns as the fire chief and the fire department. This last Friday, we had an incident involving a called-in DUI, suspected DUI. Officers got there in time to see this lady crash her vehicle. They went up and dealt with this 72-year-old female who, while the officers are right there with her, she's coughing, running a fever. We immediately, took a little lesser of approach or distanced ourselves, but the officers had already been in contact with her. She goes to the hospital, and the hospital says she doesn't have any signs. We're not going to test her. We think she had a stroke. What do we do? And my real question is, we too also have very limited supply of the N95 masks. If we started to have to wear them every day, we probably have about 3 days worth. So we are getting here in the next day or two, we are getting a supply of these DIY masks. We have a lady that's sewing us about 150 of them. We'll have at least enough for each officer, each firefighter, some of our other city employees. My intent was to start having the officers wear them on a daily basis. I'd like to know what your thoughts are.
I guess I'll talk first on this. Lindsay or Dr. Landers had mentioned earlier that their office is not masking up. Ascension, whom I work for, they just mandated a new thing starting this weekend that they call it universal masking. So they are having every single person an inpatient contact mask every single day. That includes myself, my roomers, my front desk staff. Again, PPE wise, obviously that goes through a slew of stuff. I also have one N95 mask for myself for this entire season. So I'm not wearing that. I'm wearing the surgical mask most of the time unless I have strong suspicions of it. So I think those sewed ones are somewhat beneficial, although like we've said before, really the studies have shown that those are really more helpful if they're on the patient to protect the provider, vice versa. You know, it doesn't really protect us per se as well, although it is a barrier. It's something.
To that note, the homemade masks have actually been shown to be maybe even worse than nothing, is my understanding.
Wow.
So I'm not sure I would put cloth masks universally on people to protect them.
Makes sense.
Our office does have some surgical masks. Obviously, now that we're going through probably at least 50 a day, I don't know how long that will last. But we could certainly look and see if there's any we could donate to the police department and the fire department. Just, you know, even to get you a week of help until we can get more. We're basically on allocation with our supplier, so like the rest of the country. But we have been able to get some supply in through other sources. I think that would be a safer option than a cloth mask.
Hey, I don't mean to disagree with you at all, Doctor. We've just received some information that these 3-ply and 4-ply masks were almost as effective as the N95, somewhere around the 89 percentile versus 95 for the N95s. If that's not good information, we need to change our strategy here and look for an alternative.
I guess I would need to know, I mean, are they made with some type of a filter or is it just a cotton mask? The homemade ones.
I'm sorry, I lost you for a second there.
That's okay. Are the masks you're referring to, the homemade ones, do they have a filter in them or is it just made out of cotton?
My understanding, I haven't seen them yet. We're supposed to take them in the next, sometime in the middle of this week. So tomorrow, Wednesday. But it's my understanding they're 4-ply, made of cotton. Some of the material is cotton, and I believe some's linen.
Okay. All I have is information from Dr. Moore, and I'm happy to send you the link by email if I can get your email address. Is it on this? I'm sure you're on the thread for the meeting. I can send it out to everybody.
Please. You can send it to any one of us. We can share it with the others.
Yeah, okay, I'll do that. And again, he just talks about how cloth masks could be worse. I suppose it depends exactly on how they were made or if they had any filter material on them.
This is all good information to know.
Are we being very specific the way we test? I mean, I guess what I'm asking is there possibilities that people are getting passed over because they don't have enough symptoms and we don't have enough tests to check?
Yes.
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 Okay. So really,
And supplies to test them.
Pardon me.
And we don't all have the supplies to test everybody. I mean, we're trying to reserve that as well. I think that will improve I know with the same day testing, point of care testing is coming available, but it's at least 2 weeks out at the earliest.
That's the best case scenario, 2 weeks, huh?
Yeah, I believe so for my office. Tara may have a different resource.
Yeah, we got 10 tests for our entire office. That's it. And we were told we don't know when we'll get more, so use them sparingly. I know the Kansas Health Department, or the Sedgwick County Health Department is doing testing there. But again, they're very strict guidelines. And also Ascension has set up like a tent outdoor testing. But again, they have to go through a nurse triage. They have to qualify basically using the same KDHE guidelines to get tested. So, I think they may test 20 a day, 25, maybe 30. I mean, it's very, very, very sparse testing right now.
And I think some good news in this is that if you look at the number of negative tests, it's very, very high. I mean, I believe it's over 2,000 of the tests have been negative. And so that's another reason we don't want to start testing everybody. It just wouldn't be a good use of resources.
There's 2,000, that's here in Kansas, or?
That's for the state.
Okay, wow, okay, wow. That's good news.
It is good news.
So, do we know the percentage of negative tests in the whole state, or did you tell me and I wasn't?
I mean, it would be well over 90%.
I have those numbers here from KDHE, Mr. Mayor, and it looks like there's about 94% are negative.
Wow.
And 6 to 7 are positive. There's percentage difference in there, but.
Thank you. That's very good news, at least.
I did have a question for the doctors while we have you, and I don't know that we need, I mean, you are welcome to hang out with us for the duration of our meeting, but instead of having you feel obligated to stay on all evening, we had someone contact and ask about holding, and this was a week ago, and obviously things change like every, hour, much less every day. But at the time they called a week ago, they were really passionate about the lack of blood that is associated with the pandemic, which I can see the supply chain is probably reduced when people are being encouraged to stay home. But she had hoped to use a city facility to hold a blood drive. And I told her that gave me great pause because we had at that time already shut down our city rental facilities. And certainly we were already adhering to the state's guidance on no more than 10 people together in a gathering. So just trying to weigh like the risk reward from a public health perspective of allowing a blood drive at this moment in time in a city facility, or if we are better served to say, right now, no, but come talk to us about that after this isolation period, if you will, is passed, and to do that in May or something later.
I mean, I think that if it's through the Red Cross, the measures that would be taken would be very safe. I know I got an update today that the demand has improved. I think they did a lot of advertising last week and have gotten quite a few donors. So right now it's not quite as critical as it was last week. And I know I've encouraged my staff to go and donate and given them time off to do that. I believe there's still some blood drives in town. When I looked on the Red Cross website, there was one going to be held in Augusta and in East Wichita in the next coming weeks. So I know the Red Cross is still holding them, and I'm sure they're taking all precautions that they can with social distancing and gloving and masking. And so, with that being said, we would be happy to, assist in that in any way as far as if there was a need for a facility or a weekend use of our office.
Yeah, I would agree. I looked online just to see, and there are several scheduled in the next week and a half. I think there was 4 to 6 different drives within 20 miles of Andover. So I think there's opportunity to donate elsewhere if there is hesitancy to open up a unit. Although I did read on their website that they are taking extra precautions on top of, obviously they're already super cautious, but the Red Cross is trying to adhere to the 6-foot rule, and they're trying to make accommodations so that they're as safe as possible. So I think it would be done right through them, but again, there are other opportunities available locally.
Thank you. Any other generic questions related to the current outbreak, the situation we're seeing here locally? And then we can kind of move on into some of the decision points that you all still have to make related to this pandemic. And like I said, Dr. Katz, Dr. Landers, you're welcome to stay on or you're welcome not to.
I'd like to thank both of you for being here with us, and as things go along, if you feel there's something we need to know as a city and administration, please reach out to us, and we appreciate what you're doing. I know you're going above and beyond what you normally do, as all of us are, and I personally want to thank you very much for what you're doing.
Thank you.
Thank you very much.
Yeah, and again, the city and the state are doing very good work. So I think in general we're doing as good as we can.
And thank you.
Thank you.
Okay, onward and upward. All right, let's go to 1-2, city authority related to public health.
Mr. Mayor, I thought on this one we would allow JT to give us a little bit of background on how the state has delegated public health responsibilities in the state, and then what options cities have if they should want to take on some of that responsibility themselves.
Sorry, everyone had to unmute. There's no doubt the state construct for health matters is through the county health boards. There is legislative authority created by the state, empowering KDHE, and then on a local level, the county health boards, and they are particularly authorized, in fact, in times of emergency with broad control powers, some of which you've been seeing, everything from quarantine to stay at home or otherwise. From a state law construct, this is not typically a city's role or responsibility as it relates to particularly emergency situations that emerge from the public health. That being said, cities in Kansas do have home rule authority, which comes from the Constitution, which means that within the city limits of the city, you are pretty much empowered to do anything that a state or county hasn't done for you or is doing for you. And so as a general rule, what we say is you can be more strict, but you can't be less strict than the city or county is being with respect to health matters. In the instance case, we primarily investigated this because of your proximity to Sedgwick County and the movement they were making towards stay at home. The city, and where are we, Jennifer? Are we on the ordinance? Is that where we would be, or just general information?
Yes, so before, when we wrote all of the workshop items, we did not have the statewide stay-at-home order. It was just the Sedgwick County stay-at-home order. So the information you have was provided with the idea that, do we want to mirror Sedgwick County? But I think JT is going to share with you that there might still be reason you would want to enact the ordinance that gives the city a little bit more power in this matter. And then I don't think there's a reason to do the stay-at-home resolution, because in all matter of that, it's already been taken care of for you.
Can I interrupt for a second? I do have all the council members with us tonight, don't I? I can't see everyone.
Yes, sir. They are all on my screen. Are you on gallery view?
I see everybody, most everybody. I don't know, but that's all I really need to know. No, you can continue.
Well, what I was going to say is in evaluating the city's structure, you have a health board that was formed in the 1970s. And unfortunately, its purpose is ill-defined, which is probably why it hasn't met in 35 years. But the idea behind the health board was that it could make recommendations to the city council, and the city council could adopt those by ordinance. The problem with that, of course, is an ordinance requires you to have a meeting, and it requires a majority of the council-elect to vote in favor of it, and then it still doesn't take effect until we publish it in the local newspaper. So in the instant case, if you had to do something quickly, the fastest you could do it would be to have an emergency meeting and then wait around for it to be published. So what I did in this health board ordinance, which may still have some merit, is I didn't change the recommendatory status of the health board. All it can do is make recommendations. The only change I made to the ordinance was that if it makes recommendation and a majority of the city council decided they wanted to, they could create and enforce orders by resolution, which would mean that in an emergency situation, if you wanted to, you could take action as a council and not wait for the publication to occur. So if you read that ordinance carefully, it has a broad range of things the city council could do if it wanted to, and the health board advised it to do it. The ordinance wouldn't do any of those things. It just simply would empower it in the future to do by resolution if you wanted to, which would remove the publication requirements. After that, we then did in fact draft a resolution if you wanted to, but I think that's moot now because the state has that action statewide.
And I will say this ordinance is not on your agenda tomorrow night. Again, when we created it, we were doing this in preparation of you maybe taking action to create your own stay-at-home resolution. That's now a moot point, but I wanted this discussion to occur regardless first before assuming you wanted that on your agenda tomorrow night or not. So very easy to add it to the agenda, but at this time it's not on there.
I have a quick question, if I can, for JT. This is maybe a silly question, actually, but for an ordinance like this that is really for an emergency situation, is there a end date on this ordinance, or would we have to come back and, I guess, repeal the ordinance, or how does that work?
Well, to be clear, the ordinance doesn't do anything except create a legal construct where you could act in the future if you wanted to.
Okay.
It does not have a termination date. There's really quite a flaw in your code. You've got this whole section that creates the health board and then doesn't empower them to really do anything.
Okay.
And so really this ordinance is a fix of that says you do have a health board, and if they make a recommendation to the city and you all think it's a good idea, they can't do it themselves. I didn't see empowering them to act on their own. If you all think it's a good idea, you'd be able to do it right then and not wait. So really this ordinance does nothing except, in my view, fix a flaw in the existing code where you had a health board that didn't have the ability to do anything, and allows you to do it in the future. The reason why I think it might be a good idea, quite frankly, is because when Butler County did consider whether or not it would issue an order, what they said was very polite. They're like, nah, we're just going to do what the state tells us to do. But if the cities want to do something different, we're okay with that. And the problem is, when they said that, we wouldn't have had the legal authority to do it. You don't have health board powers unless you have an ordinance that says you do. And right now, you don't. So that would be the ordinance itself does nothing except create a mechanism that could be accessed in the future.
Okay.
Andover's
So
a very.
JT,
I'm sorry,
JT,
go
if we
ahead.
do this ordinance, Does the county still have power over us then? I mean, if we say we don't want to do that,
Absolutely. If the county has the absolute authority. So to give you an example, if they issued an order that said, look, we're not going to let people of more than 10 gather because it's so contagious. And you all got together and said, we want ours to be 25. Yeah, you couldn't do that. You can't do that anyway. That's a state law. They get to decide that. Now, would you be more restrictive? Could you say, and in addition, we want to close the tattoo parlors because what we discovered is needles are doing. Yes, you could, but not without this ordinance. You couldn't. You can't do anything without this ordinance.
JT, does the home rule apply to the city or to the county?
Does what, Mike?
Does the home rule apply to the city or the county?
Only cities have constitutional home rule authority in Kansas.
Okay, so if we had the home rule and the county overruled us with doing their own thing, our home rule wouldn't matter.
Not if it were contrary to what the county said, because what home rule allows you to do is basically govern anything within your city limits the way you want to, unless the city and county have substantially entered the field and told you to do it differently. The biggest example I like to give is, it's not like you could use home rule to lower the drinking age. It wouldn't work. They've entered that field and they've decided what it's going to be. But you could, and some cities do, for instance, make liquor stores close earlier than 11 o'clock, because within their home rule authority, they can further restrict it. In Winfield, liquor stores have to close at 9. They can't be open until 11 like everywhere else in the state. So home rule will allow you to be more restrictive only within your boundaries, but it will not let you be contrary to established state and or county authority.
So if we had this ordinance on the agenda, it still wouldn't be enacted by saying what businesses have to stay home or not.
It doesn't say anything like that, the ordinance.
Okay.
All it says is, if in the future the health board makes recommendations to you and you want to take those recommendations, you can take them right then, because you've adopted a law that says that you're allowed to do that and you've published it in the newspaper. It just simply allows you to act without publication in the future.
It's more to protect us as a city of Andover. Correct me if I'm wrong, JT. It's more to protect us as a city of Andover, that if the county has lack of action, which no other city in this county has the proximity to Wichita that we do. So if Wichita says, listen, we're shutting all of our businesses down because we have a crazy epidemic, then if we're not, and we don't have to agree with Wichita, but it protects us from having those folks that are infected come to our town, because it's close and they can come over here infected or not infected. So it gives us the opportunity to say, hey, we're not Augusta, we're not El Dorado, because we're closer to Wichita, and that we have to protect ourselves from epidemic like this if it ever rises. We don't have to use it, but it's there for us to use. Is that correct?
Yeah, and I believe that's exactly right. And I believe that was the intent when it started in the 70s. It's just nobody ever finished it up and brought it along to where it could actually be used. And this would just put it in place for the future.
And the health board still triggers this ordinance, right? So the recommendation has to be made from them. It can't just be, somebody on the council thinks we ought to do something and we talk about it and agree.
That's an important point, Shelby, and that's exactly right. It basically, the ordinance has two constructs. One is the health board could get together and just recommend something that should always be the law. Like, for instance, trying to think of a good example. some infection has infected the groundwater, and so people should not be drinking out of their garden hose. The city of Andover could adopt an ordinance that prohibits drinking out of raw well water out of a garden hose. And that might be a good rule anytime. But the other thing it can do is, in an emergency situation, if it's an emergency, they can come and make a recommendation and you can act on it right then. You wouldn't have to wait to enact an ordinance. And you're right, though, it would still have to be, you couldn't do it on your own. The health board would have to say, yeah, we think this is a good idea and are suggesting it.
Okay.
I would just say too, I feel like kind of my view of your agenda tonight and the COVID related items on tomorrow night, the theme is flexibility and giving you all more flexibility in an incredibly dynamic situation. So not that you necessarily have to utilize some of these tools, but they give you more flexibility and agility than you have right now, where you're waiting for 2 or sometimes 3 weeks for the next opportunity for you to all be together. And in a situation where that may or may not become increasingly difficult.
Part of the,
Troy,
go ahead, I'm sorry.
I'm sorry, Mayor. Just one thing, and I don't think anything that we're looking at tomorrow nor tonight really oversteps this, but I guess I would like to keep my eye on, and hopefully everyone would, on giving us the authority to overstep what we really should be able to do as a city council or a mayor. Not that any of us might have nefarious reasons for doing whatever, but we certainly don't want to give, the mayor and council 10 years from now the ability to do things they really shouldn't have the ability to do.
Right.
I don't think any of this is there, but I think we're pretty close to giving us the ability to start doing things that perhaps we should have more public input before we make decisions of things to do.
Troy, I completely agree with that statement right there. That was kind of that's a concern I have about a item that's on the agenda tomorrow night. But I do believe that we need to probably put this one down in the books, especially if the health board recommends it. And then we, currently, JT, don't we, if they recommend something, we actually have to write the ordinance up and put it in the paper and publish it for 30 days, correct? You're on mute.
JT, you're muted.
Anybody can read lips?
I just didn't want you to have to listen to my dryer in the background. Yeah. And I'm sorry, what was the question? Because I provided the answer and now I forgot.
Basically, this is if we have a health related issue, the health board will take it, pass it on to us. We'll say yes or no, and then it goes directly into law or ordinance or resolution. While the current way is it will have to be published for 30 days in the paper, correct?
Yeah, it would have to be published and you have to have it up for 10 days. Yes.
10 days. Okay.
But we would have to agree to it, right?
They could come in and say, what you need to do tomorrow is stop people from eating beef because we found it's infective and it's killing everybody who eats beef. And you could look at them and say, I don't care. I like beef. Thank you for your opinion. That's how soft this ordinance is.
Does that help, Troy?
It does for this very specific ordinance we're talking about tonight, but not necessarily for the one tomorrow. So, yes, sort of.
Well, and I intended for us.
Not, so why don't we do them one at a time? Because I agree some are different than others.
Hey, before we move on to the next one, I just have a general question. I know that we have some businesses in town that are going to be affected by the state's ordinance. What are our thoughts on some of those businesses being closed or limiting what they can do or how many people they can have in their facility? Or because it's kind of vague on it doesn't really call out what businesses should be open or closed. It just says food or medical or household necessities. medical care and child care and stuff like that. But how are we going to allow our own businesses to keep operating and not let them fold?
You know, the federal government, they signed the law that allows the Small Business Association, or SBA, to give forgivable loans to all the small businesses with, I believe it's 500 or fewer employees. So pretty much every business in Andover would fall under that's my understanding, meaning that they could get a loan up to the amount that it would allow them to pay their employees and not go out of business. And then I don't remember the exact numbers, but once this is all over, as long as they reemploy or keep their employees at that point, then they can forgive the loan that they took out to cover all those costs would all be forgiven. In addition to that, for those that are laid off, the unemployment insurance kicks in and they're paid the standard unemployment plus, I think it's $600 per person for the unemployment, they're paid an extra $600. And then if they make less than certain dollar amounts, there's additional payments on top of that. So I feel like if they do have to close their doors, there are a lot of things already in place now to cover them.
Is
And
that something that maybe we can like send to all of our businesses in town to let them be aware of it? Because I wasn't aware of all those, and that's really good knowledge for them to all know. And what if they can't make their rent on their facility? So that loan would hopefully do that as well.
yeah, that's what the loan's for. I mean, really, it's there to pay their bills. It's not necessarily there to pay their employees if their employees they can't work. That's what the unemployment is for, which again, it's been beefed up for this.
Okay, I'm gonna have to correct that. The CARE Act will actually allow you to pay your employees with the proceeds of the loan, which is 2.5 times your average monthly payroll. And you can pay rent, utilities with it, and you can pay your employees with it. And if you keep those people employed through September, then it's forgiven at the end.
Oh, wow.
There you go.
How quickly can we let our
The other-
businesses know this?
Well, I mean, unless they're just not looking, this is all that's on the internet today, is this act that takes effect April 1st and April 2nd. And so the big problem is the bankers are swamped right now because they're getting so many phone calls from everybody who wants to take out one of these loans. The other thing is, before we try to get into areas that again are outside of our control, the non-payment of rent, you can't be evicted right now if you don't pay your rent. It doesn't mean you don't owe it, and it doesn't mean they won't get it from you later, but the court system is such now that you cannot be evicted for not paying your rent, business or residence. That is a state law situation.
I did want to say just a couple things. We have been sharing everything about the SBA, the webinars, everything with Becky Wolf, the chamber director, because that's kind of her audience and what she does. So she has been sharing that out. And as soon as we get it, we have shared that with her. I apologize because I had thought I sent you all the governor's order on Saturday, and I do not believe I did. So I am now sending that to you because, Mike, it's pretty specific, actually. It really kind of comes with the base of everything's closed, and then all these like 27 items are exempted. So if you are not one of those things that are exempted, then you're closed, is how we have been interpreting that thus far. And I believe most in the state are interpreting that. Was there anything in specific you had questioned?
That's not an interpretation. If you're not on that list, you're closed. I saw a pretty good seminar today where someone said, if you have to wonder whether or not you're an essential business, you're probably not. But
Okay, yeah, I had just gone to their website and pulled it up. I didn't know there was a different one, but the one that was on their website was pretty vague. I mean, it had 5 bullet points basically. So, but I'll look at this email and read through that. Thanks, Jenny.
Of course, as everybody keeps saying, it seems like every business is essential, except for, it seems like hair salons and barber shops and nail salons. That seems to be the only ones that are shut down.
And eat-in dining.
Bars and restaurants are shut down except to delivery and curbside service. And
Correct.
I think if you're any kind of a gift shop or memorabilia shop or anything like that, you're pretty much closed.
My bar downstairs is open for anyone if, as long as there's less than 10 people.
I will say, Tim, I was kind of feeling too like, oh, everyone's still working, but the Business Journal put something out on, I believe, Saturday that said 40% of the metro area jobs were closed as a result of that order. So I think there are more than, and maybe not in Andover, but I think maybe in the metro area, there's more that fall into those categories than we initially expect.
Furniture stores, arts and crafts stores, almost everything you see driving up and down Rock Road needs to be closed.
Yeah. I was shocked. We drove through the Kohl's parking lot on Saturday, and I figured they'd find some loophole to be open, but they were shut down. So,
Could somebody who cuts hair, it's a friend of mine, Huck, who owns the Plaza Barber. He contacted me this afternoon. It's like, can I cut hair from home? And I was like, I don't know.
I know I've heard some cosmetologists indicate that could be a problem with their license, but I would advise they check with the boards that license them before they would do that or not do that.
He did mention that he was worried about it. He didn't want to lose his license. So,
yeah, the State Board of Cosmetology has sanitation requirements for places in which those services are performed. And so what he probably ought to do if he's cutting hair in his basement is not to tell anyone about it. Certainly not have it on a workshop for a city council meeting.
I would say that type of business would be prime for the SBA loans that we talked about.
I agree, Troy.
And I do just want to, as just a quick aside from somebody who works at a bank, it's going to take a little bit for the banks to be able to kind of put those things through. So you may just tell anybody you're recommending it to have a little bit of patience, because that just passed and we don't really 100% know how that's going to look right currently. So definitely a great option, but it's going to be a minute before they can get those put in and things start going. It won't be quite an immediate process, unfortunately.
Yeah, we're just so everybody knows, we're expecting 2 waves. The first was the banks. We're all explaining the law to the banks today. And then next week, we'll all be explaining the law to the borrowers. So.
I'll be waiting.
It's not just a flow of cash. Oh, sorry, Mr. Mayor, go ahead.
I was just being smart. Like I said, I'll be waiting anxiously for the barber thing to come through.
And actually, just to be clear, so we don't give false hope, the barber is probably the worst example, because if he's working as self-employed, he's not going to have a payroll, so he's not going to be able to borrow money. And how much money you can borrow through that forgivable loan program is based on how much you are paying other employees to work. And self-employed people, I think, are probably going to get hit the hardest.
Okay,
Anything else? Any more questions? Statements?
You want to move on to item 1.3 and talk about these other items that are on the agenda tomorrow night related to COVID, Mr. Mayor?
Yes, ma'am. Let's move on to 1.3, other governing body action related to COVID-19.
I would actually like JT to introduce the appropriation ordinance and the declaration that allows you to cancel non-essential meetings, as well as the amendment to KMC's lease. Those are all items that originated more from the legal side of things than from anyone on council necessarily requesting those. And then I will be happy to talk about the COOP plan if you want to talk about that, JT.
Sure. Well, let's start with the annual appropriation one. So this was an idea floated right away by the Kansas League of Municipalities. A lot of small, tiny towns in Kansas that can't get together regularly adopt an annual appropriation ordinance. Because what you do at the beginning of every meeting as part of your consent agenda is you authorize the payment of the bills. You appropriate the payment of the bills. And if for some reason we were not able to get a quorum or have a meeting, the opinion of everyone has been you'd still want the city to pay its bills. You'd still want it to pay its police officers. You'd still want it to pay its fire department. Even if 4 of you had coronavirus and couldn't Zoom in or we could not get a quorum, you'd want the city business to go on. You'd want to continue to pay the bills and pay the employees you need to. And so what the annual appropriation ordinance does is it goes ahead and it appropriates out the remainder of the year and basically says that so long as it's within the original budget as a line item, it could be paid without your approval. For instance, the payroll comes around, you would not have to have a meeting to make payroll. Payroll could be paid without your approval and you could retroactively approve it at the next meeting. That would be lawful if you have an annual appropriation. What it would not allow is for you to spend any money on anything for which there isn't a line item already established. And so whereas Jenny has some spending authority, please remind me what it is.
$5,000.
That she could spend within meetings. Obviously, that wouldn't sniff on the payroll. So Mulvane and Heston have already adopted this ordinance, but as have a lot of other cities. And basically, it just simply allows the bills to be paid if for some reason you can't have a meeting to approve them, because it's not lawful for Donna and to cut the checks and to pay everybody. Even the mayor can't sign the checks and pay them unless they're approved. And so this appropriation ordinance would simply allow things that are in the budget to go ahead and happened if you couldn't have a meeting. That's the first recommendation. It wouldn't change anything if when you're able to have a meeting, you have a meeting, you'd still do your regular appropriations. Your auditor's going to want to see that. Everything would stay the same. But in the event you couldn't have a meeting, this wouldn't prevent the bills from getting paid that need to get paid. That's the first one on the agenda. The second one on the agenda that my other 2 cities have considered, and that we know a lot of cities have considered because I attend the league meetings they're twice a week now, is the notion that during a time of an emergency, if you were scheduled to have a non-essential meeting, it would empower the mayor to go ahead and call it off if it's non-essential and there is a state of emergency. And I want to give you a good example of where this is the case. Some of you have contracted the disease and some of you haven't. There's nothing important on the agenda and there's no reason for you all to get together. This would allow the mayor to say there's not a meeting. Now, by law, you have to have 1 meeting a month anyway, so this isn't that big a deal. It would basically empower the mayor to cancel only 1 meeting a month for the city council. He could say, we're just going to skip this meeting because everybody's so sick and getting everybody together is not a good idea and we don't have anything important on the agenda. More important, however, where this one is probably going to be more important is, let's say you have a planning commission meeting that we know is likely to draw the ire of a lot of citizens. Look, we all know I've been to a meeting in your city hall recently that would not have been legal today. We couldn't have that meeting with, 150 fire-breathing, angry people there. And the problem is the law makes us follow a certain progression. So if the planning commission had a hearing then all of those people might feel like they can't come because we could only let 10 people in the room for a public hearing. And then after that decision was made, they have a certain number of days to go door to door and circulate a protest petition. And if they can't do that door to door and circulate that protest petition, then their rights are taken away at the next meeting. The thought would be, in my view, if we can see that coming, we can talk to the mayor and say, look, it's not essential that we do that this month. They're not going to start building the new tattoo parlor everybody hates today. We could just put this off for a month and consider it then, and everybody will be healthier. And so the second ordinance allows the mayor to cancel a meeting if he believes it to be non-essential during times of emergency. Kansas law says a city council has to meet once a month, one regular meeting a month anyway, period. So it would really only authorize the mayor to cancel one city council meeting in a month. And I thought that might be a good idea. The other cities have done it. What's the third one, Jenny? And then they can talk about them all at once. Oh, the third one comes from a phone call I got from the Kansas Medical Center. They're trying to figure out what they're going to do if this pandemic hits with the force that's expected, because Andover does not have near enough isolation rooms to isolate the people. And because they had just built the brand new adjacent facility that is an ambulatory surgical center, those surgery rooms, as I understand it, meet the criteria for isolation as you'd expect. They're surgical rooms, so they're safe and they're germ-free and they have certain things in them. And the Kansas Medical Center, in looking at its emergency room in Wichita, determined it would not work because of radiology situations. And so asked, gee, if we get hit with this wave of people, rather than to just keeping them all in the hallways, could we use the new ambulatory surgical center? And the answer to that was no, because the people who own the ambulatory surgical center are not permitted to sublease that building for anybody else's use without the city's consent. And so I told Steve at Kansas Medical Center that I was pretty sure on the 31st you would consent to a sublease of that facility if necessary to treat the sick in an emergency situation. So on an emergency basis, we drafted up a resolution that says if in a state of emergency and they need to use it, they can use the ambulatory surgery center as an offshoot of the hospital and sublease it to the hospital for the period of time necessary to treat the people. This is one I would highly encourage you to adopt. The other two are just suggestions. So those are the three, I think, that are on my list.
So, unless Ron, I mean, I'm going to speak unless Ronnie wants to speak first. Nope. Okay.
No, go ahead, Troy.
Thank you, Mr. Mayor. So there's three things. The going backwards. So the last one first for me would be, what if we had a different type of event where we had a couple thousand people really get injured, not just from a pandemic, but an injury? Why don't we have the authority as a city? Why wouldn't Ronnie be able to designate, let's just say, the school gymnasiums as a place that the medical center could take over, or other places that would be appropriate in the time of a big need outside of, I mean, we're kind of narrowly focusing here on just this one little thing. I'm not saying we need to make a decision about it tomorrow, but if we're going to really look at a real issue like another tornado that hit us or something like that, then we probably need a little bit more of the ability to look at large areas or buildings that aren't, or that could be converted or whatever. And maybe we don't have the authority to do that, or we shouldn't. Maybe that should be a FEMA thing, or the emergency management group out of Butler County that manages that. I don't know, but I think that maybe we should think about, I'm okay with this, but I think it would be better, or not better, but in addition to look at even more later. So going backwards, the second thing, and I've thought a lot about this, and I had heartburn about the mayor, giving the mayor the ability to cancel a meeting, not just for Ronnie per se, but in the future, there's the potential for abuse of that kind of thing. But if it's also caveated with it being during a time of emergency such as this is, that makes me feel a lot better about it. The caveat is what makes me feel better about it. Without the caveat, I could potentially foresee nefarious person in that position not wanting something to be pushed through zoning for, and suddenly we cancel the zoning meetings for the council meetings or whatever. That could happen. I don't think we're going to do that. I don't think Ronnie's going to do that. But that absolutely gives the mayor, if they just don't want something to happen, they get to say, well, fine, we're not going to have the meeting. So yeah, you're not going to get your business or whatever. So, but again, the caveat with being in an emergency helps me with that. And the last item would be the appropriations. We can always get creative, or people can always get creative with the way that they do accounting. And so if we're going to give up the ability, or give the ability for any anything that's been appropriated in the normal yearly budget process to just be okayed and they just do it, perhaps we should think about putting some kind of control over that by like maybe only allowing very specific types of items that are in there to have the authority to be paid even without us. Not everything in a blank check, as long as it's within the document. Because again, there's some pretty general items, line items in our budget that are to pay whatever. And so I don't know. I just feel like we should be a little more specific than just saying anything that shows up in the budget and has a line item can be. And maybe I misunderstood what you were saying in that, but I don't think so. So I don't know. I think we should think about that as we talk about maybe making that pretty big change to the way we allow things to be paid.
That's, correct me if I'm wrong, Jenny, that was through the end of the year, correct?
It is, and I think it was it goes in conjunction in my mind with that ability for the mayor to cancel a non-essential meeting. I mean, I think the purpose of approving that appropriation ordinance is that if, God forbid, 2 of you have corona on April 14th and 2 of you are dealing with spouses who are very, very ill, and we don't think that we want to have the meeting, then the ability to cancel that meeting and the ability to pay the bills that have come due is what those allow you to do. In essence, it allows you to cancel that council meeting without repercussion. And I don't know that you would want to get too specific, because I see what you're saying, that maybe certain purchases the city makes are more deemed important or valuable. But on the flip side, I guess I would say if we've agreed to pay a bill, we've agreed to pay a bill. And I don't know that you want to say, well, this is for the coffee service at the city, and that doesn't seem as important as the paper purchase, so you're not allowed to pay that bill.
Well, I don't want to suddenly, it comes up for time for us to talk about a $600,000 truck that was on the line item, but now we're in the mid-year and maybe things aren't going so well monetary wise for us as a city. We should be talking about that before we okay. It should not just come up and suddenly, boom, we got a new $400,000, $500,000 truck coming in. So yeah,
that's a good point. And I actually have told staff that I don't want to see any capital. I don't want to see any movement on any capital purchases for 2020. If we have not already committed to those right now, until we see the tax receipts, which we should get in June, unless the state moves back the tax date from May 10th, which they have been discussing as a possibility to help people. But the league has been advocating that by helping the citizens, you're really putting your communities at a disadvantage, because they need to know what revenue they're going to have to work with. We have been told to estimate 15% increase in delinquency, because citizens, one of the first things they may opt to not pay for would be their property taxes. So that is of grave concern. So perhaps we can add some words to the ordinance that would say no capital purchases would be authorized through this act. I don't know what you think about that, JT.
You like that, Troy?
Yeah.
I don't know that an appropriation ordinance actually approves capital expenditures. I guess I didn't think it did. So I think it just appropriates bills that has incurred, it wouldn't, for instance, authorize the chief to enter into a contract to buy a fire truck. He'd have to have that contract signed by the mayor, and that contract would have to be approved by the city council. So when we talk about appropriation within the line item, it means that we're appropriating regularly occurring bills within the line item. It doesn't mean and no accountant would let you use it to make major capital expenditures, unless, to give a, for instance, in theory, I think if there were a municipal equipment replacement line item during this time period, and Chad would say, I've got a paramedic that needs this device and it's broken, and I have to order it to save people's lives. We're permitted to do that, but only to the extent and not to the extent it would require a contract. And the thing to keep in mind is big purchases require contracts. You can't just buy a fire truck off of you can't even buy a police car off the car lot. You just can't. But if you wanted to say restricted, provided no capital purchases shall be made, you could easily add that to the appropriation ordinance. I just didn't think it approved that anyway. To Troy's point, I actually think there's two caveats on the other one, not just the one. It's not just that you have to be in a state of emergency for the mayor to cancel a meeting. It's that he has to be in compliance with state law, and state law requires you to have at least one regular meeting a month. So I think there's two caveats on that one. He couldn't really cancel all the meetings in an entire month. And my only thought about there is it kind of is an inconvenience if you all have to show up only to find out there wasn't enough of you there to hold a meeting, because then it is canceled. If you don't have a quorum, the meeting's canceled. So, I mean, you can do it that way too, and have those who are healthy enough to show up, and then just say we don't have enough. I just thought this would be easier.
But that's
So-
only when it's a state of emergency, correct?
What's that?
That's only when it's a state of emergency as described by section 1-102.2, correct?
Correct.
Okay.
And the appropriation ordinance, this one does have, this is until the end of the year and then it's no longer. Did somebody say that? Or did I hear that incorrectly?
You can't appropriate outside the current budget year, so this would be over on December 31st. No matter
Okay,
what.
so this one goes until December 31st, and it's only the case if Ronnie decides to cancel a meeting that it
Oh.
would come into play.
No, I've confused issues. The emergency ability to cancel a meeting would not end at the end of the year.
Right, but this appropriation ordinance that will end at the end of the year, the only way that comes into play is if Ronnie does decide within this year to cancel a meeting that he would deem unnecessary.
I think that's not correct. I think that it would allow people to spend money. You're probably right, Shelby. As a matter of practicality, if he doesn't cancel a meeting, then the bills are all going to be there for approval. And of course, you can always disapprove a bill.
Sure.
But it is a legal change in that the auditor would not require the council's approval of a specific line item to make an expenditure for which it was budgeted through the end of the year.
So it would be, not to say that this would happen, but it would be possible for that particular bill, even if we did have a meeting, to not be on the agenda. Is that it illegally allows them to just pay it without us seeing it, even if there is a meeting?
No. I think that it would allow it to be paid without you seeing it, but it doesn't change any of the construct of what you require from your staff as it relates to all the bills being on your agenda. It just simply makes it legal. Right now, it is illegal to pay a bill unless the council approves it. That's why Donna puts the payroll and every bill on the agenda. The exception would be Jenny's $2,500 spending authority. So it does in fact make it legal to spend money without council approval. Troy is right about that.
Okay.
Through the end of the year.
Through December 31st.
But it would still be, Jenny, it would still be put on the agenda for us to
Right.
look at.
Right. So this all kind of goes back to, and I feel like I'm not being clear, and I'm really sorry about that. I'm trying to figure out, I think that we all just are getting so much information right now that it's hard to communicate well. I'm not using my words right, as we tell my 4-year-old. These would all just be tools to give us flexibility, but it doesn't mean we'd have to use them. So in my mind, the only reason you would use the appropriation would be because we can't have the meeting on the 14th because half of you are sick, or Lance, me, and Susan all have corona and nobody put a packet together for you. And so you think it might be best to go ahead and wait till April 28th for the next meeting. And then these 2 items have allowed you to do that and not have the negative consequence of bills not being approved and having to wait a whole month for that to occur. But if we meet on the 14th, as we intend to meet on the 14th, like this, because we know the state order goes past April 14th, then tomorrow, or I'm sorry, April 14th's agenda will have an appropriation ordinance on it, just like normal. It's all kind of doomsday, but that's kind of where we are.
We will continue to do Zoom meetings, correct?
Until we're at a point where we're able to meet again safely by state or county orders.
And Zoom can handle what, up to 100 or more participants at once?
I don't remember which one we bought. Susan, do you recall how many?
I don't think how many licenses. I don't think how many licenses people matters. I think Mike's right. I think you could have up to 100 free participants watching your Zoom meeting.
Yeah. So
watching is unlimited. We're airing on City 7 right now, and we're airing on YouTube. So the question comes in if you want to have like Dr. Landers and Dr. Katz were like a participant in your meeting.
100 participants, up to 100, but it was a matter of cost effectiveness. I think there's higher tiers that Craig could have looked at, but he didn't think that it was necessary that we go up over that amount of people at this time.
To Mike's point, though, you're on TV and you're on Facebook, so you have unlimited number of people who can be watching you, which I think was your question, right?
Correct.
Yeah, it was. And also, what if someone wanted to have a public input?
Please don't.
State law does not require that you allow public input at any of your meetings. This was, I guess, an interesting aha moment for me, but Andover has just traditionally had a public forum at every meeting. So the league's strong advice right out of the gate was that if cities are doing that, we weren't alone. There were others, but not many, that we go ahead and remove the public input part of the meeting during this pandemic. And if we have controversial items like JT was referring to earlier, if it's at all feasible to push those to a later date, that would be best so that you don't get into a situation where people feel like they didn't have the opportunity to be heard.
I will add a moment to that, when I sent out the agendas to all of the people that request the agendas, and it is on the portal page that if you had any questions or comments to send me an email by noon today, and I have not received any emails. So,
and they can always email. They can always email tomorrow if they see something they don't care for or don't like. Then they have that luxury.
Well, and they could email at any time, any
Right.
of us, but I wanted to put that out there because if there was somebody that felt there was something controversial on either one of the agendas, they would let us know. But
right.
And I can
Jenny, that was good info. I didn't know that the public meeting was not a required thing. So that's that was one of my 2 questions. Thank you.
Anyone else? All right. Shall we move on?
Sure. I can talk to you just a little bit about the COOP plan, which is something we started working staff somewhat feverishly at the beginning of the month because we started to see that this pandemic seemed to be coming our way. And so that is the document that guided the communications I've emailed you all before I've sent it out to city staff, where we delineated essential versus non-essential functions, which then in turn determined who we would deem to be the essential employees. The word essential has gotten used a lot in this whole context of the conversation. And so, you know, the state's got essential businesses and non-essential businesses, and we're saying we have essential personnel and non-essential personnel. And the important thing to note is that it's not that we don't think these jobs are important. If we didn't think they were important, we wouldn't pay them to do the jobs 365 days a year. But what we're trying to say is this is a function that must be done in 1 week, a function that must be done in 1 day, or a function that has to be done in 1 month. And if it meets some of that criteria, it's essential. It has to continue to get done. So great examples are, like I said earlier, your wastewater plant has to continue to function at the correct capacity. And so someone is coming out from that staff daily, an operator who's certified to manage the plant and doing so. Police, fire, 911, those are essential functions that don't go away. No matter what's going on, we still need to respond to public safety. And then there are things that we're saying kind of maybe a little bit on that within 30 days, we want the utility bills to go out and we want to process the utility bills. So depending on the crisis, is it necessary in 1 day? No, it could get pushed. Is it necessary in 1 week? It could get pushed. When you start to get to a month, or gosh forbid, it looks like this is going to go past that, then we start to want to pull those into essential and say, no, we're going to go ahead and at least process the bills and things like that. So the COOP plan is finished and it is in your agenda tonight. This is not a fully public document because there's some pretty important details regarding what we would do. This is an all hazards plan. So there's certain things that we wouldn't necessarily want everyone to know what we're going to do in certain situations. Those are important for those who need to enact those plans to know, but quite frankly, there may be people that don't need that information in their hands. Additionally, there's some very personal contact information up to and including emergency contacts for all of you and their phone numbers, and just information that's not necessary to be handed out. We do have a very short executive summary that explains the purpose of a continuation of operations plan that we can certainly provide. But really the purpose, the heart of it, is to define what those essential city functions are and what our plans would be if for some reason we can't do those any longer due to illness or what have you. Do you have any questions about that document?
Cindy, I actually have a question. The stuff that we worked on for the fire department, I haven't found it in the packet.
We did not include it because we felt like it was really, really specific to the fire department. We felt like this was an organization wide, but I think it's important to know earlier in that conversation when we were talking about, would we really just stop responding to fires? I mean, both chiefs were especially careful in going through what triggers, and they have multiple tiers where, you know, from the very easy stuff, we're going to stop doing donuts with the chief because that's just extra exposure. That's not the most important use of our time, up to starting to make those decisions that, well, emergency accident reporting is going to be in place. So if it's a fender bender and there's no major damage and we don't think there's alcohol or drugs involved, now we're not going to respond to those. And if either of you want to talk about what those specific plans are, please feel free.
I usually let Chief Keller go first, but I'm already unmuted, so I can go first this time. I think that it would be important to talk about our phases and let you all know that for now, we've basically locked your firefighters in the building and said, don't leave unless the bell rings. Of course, they have to go out and get fuel. And other than they've been taking advantage of the fact that some businesses are closed, and we've been doing some training where we're using social distancing and not around other folks, but we're able to do things like that. But we've canceled no public allowed in the fire station except for emergencies, no ride-alongs or department tours, no community meetings or birthday parties at the fire station, etc. There's a list. As we continue to go, I think it would be really important to discuss just what Councilman Tabor was talking. This is a really big decision. I completely agree. I think to go to the next phase means that per the plan, we stop responding to those low acuity medical calls. That's a really big deal. And I think that could be within days of saying that we need to do that. So I really would like some direction tonight, if I could get it from you, on what your thoughts are and how you want me to handle it.
Chief Russell, I'm sorry, I don't quite know the language. Can you tell me kind of what those calls would look like, those ones to stop responding to?
Yeah, so an alpha medical call, which would be the lowest acuity, could be a headache. It could be literally, I have pain in my toe that has been there for a week and I need help. It could also be, if it were worded just correctly, if the caller states just the right thing, it could be somebody has twisted an ankle. So no obvious fracture or anything like that, but they have ankle pain, something like that. And then you move up from there to Bravo. You might have somebody who, I think we had a Bravo crash the other day where a gentleman crashed his bike. Now, to be clear, that was a terrible example because your fire department's going to go because we have a fire responsibility at a crash. But the medical example is he crashed his bike and he had pain in his hip, and that was a Bravo call. Charlie call goes up from there, and I think I haven't talked with Jenny about this. I'm sorry, don't be mad, boss. I just realized late this afternoon that I think I made a mistake in the plan by not including Charlie, right? By not including Charlie's in phase 3. And it was actually one of your captains that brought it to my attention. The worst acuity you can get if you're having a stroke is a Charlie. It doesn't go above that. And those are folks we need to be helping. So I think Charlie should be included in this. But that's kind of the level if you start thinking about, you can have a Charlie chest pain, you can have a Charlie respiratory distress, those types of things.
And what happens if you don't respond? Does somebody else respond, or is it just, what happens when you don't?
So we left the plan kind of loosely written so we can respond to what's going on, not only this week, but today, and not only today, but this hour. But to answer your question, if there's an ambulance in town, they're going to respond, and they're going to have similar response time to us. So if we were coming to your house, well, if we weren't coming to your house, but you had called for a response, then the ambulance crew would show up. They would have 2 people there. And if they needed our help, they would call us and we would respond afterwards. Now, that's if they're in town. If they're not in town, then you could be waiting for them to come from another town. And I think that's appropriate for alphas and bravos under the situation we're in right now. I would not want to do that every day.
Okay.
And so Chief, a Charlie would come in under your level 3 reduced
Yes, ma'am.
services expanded.
Yes, ma'am.
Chief Keller, did you want to talk at all about your various pullback plans?
I had to find the mute button there. Yes, we too have implemented a plan that has 4 phases to it. Our phases are very fluid in that we have certain parts of phase 1 that we can incorporate, or parts of phase 2 that we can include in phase 1, depending on the needs. But basically, what the first part, phase 1, is we closed our police department to outside traffic, and we started eliminating some non-essential services like fingerprinting at the station, donuts with the chief, like Jenny said, presentations, demonstrations in the community, those kind of things we started out with eliminating. And then we moved into phase 2, and that's a little bit higher. That's where we implemented the ERP, the Emergency Accident Reporting Plan, as Jenny described there. We also started taking some calls where it's not essential for a police officer's response onto the scene. Those less minor things where an officer isn't needed. We started taking some of those reports over the telephone to avoid having the officers go there. And then we also stopped going to medical calls. We are not typical responders to medical calls. Sometimes our officers will jump those calls and try to assist. But we've kind of said not to make these kind of calls because they don't have the equipment to handle it. So that's kind of where we're at right now. The next phase is phase 3, and I, like the fire chief, would also like a little bit of guidance here. We have our school resource officers are not in school, obviously, so they're back on the street. And we've also placed our captains on the street so that we have 7-day-a-week command staff people there. And our initial plan was to, when we go to this phase 3, to send half of our police staff home and like for 2 weeks, and let half the department. This would allow us still to keep our minimum staffing on the street of 3 officers, but have them in reserve in 2 weeks. If this thing's going to go on for 4 weeks, 8 weeks, to have those officers in reserve and then send the other home. We've looked at that more and more, and that really has some problems because we just have enough people to do that. If we lose one person, then that kind of throws that whole thing into a mess, and we're pulling people off the other teams to be able to cover. So what we believe we're going to try and do, if you agree with this, is if we go to our 3rd phase, which is, I'm recommending we do it sooner rather than later, where we would, every day, if we have more than our minimum staffing of officers available and not needed, we would send them home on a day-to-day basis. And then that way we have them there. We're not changing shifts, pulling them off other details. And as we start to lose people, because we've already lost 2 officers to quarantines for different reasons, and neither one are sick. Make sure but because of, like, one was a military travel to California, that we would still be able to handle all the calls and have people in reserves. So that's our plan for phase 3. And I'd like to start that with your input and as soon as possible to preserve our staffing so that we can make it through this 8-week, 10, whatever it ends up being. The phase 4 is the final phase, and that's where we've reached the point where we cannot provide the law enforcement services and we need outside help, such as the highway patrol or even the National Guard.
Okay, so Chief, did you say that you already have 2 people that are quarantined, although they're not sick, right?
Absolutely.
Yeah, I guess I'm just gonna say it. I feel, in my opinion, you should both departments phase 3 right now. We have people that are sick in Butler County. We have people that are sick in Wichita, and it's coming. Whether it comes tomorrow or 3 days from now, it's coming. And I guess, in my opinion, I feel like you are the most important staffs that we have. Love you, Jenny, and all the rest of the staff. But as far as saving lives, you were the main one. Well, the sewer department's almost up here too, but so I mean, my opinion, I would say do it now.
I would say I agree with that. Chief Keller, will your reserve officers, they'll get paid their normal rate since they're being sent home involuntarily?
Okay, just for clarification, we do not have reserve officers. Just to make sure.
Oh, I just meant for whatever your phase 3 is, that you're sending people home.
I referred to them as reserves. The ones we're going to hold back, yes, they would still be just like the non-essentials that we've already sent home throughout the city. They will remain they'll be paid for that time, and they'll be expected to remain home and remain available during the times they should be working, should we need them for immediate response.
Okay. Yeah, I would say definitely it's a good time to start doing that for both the police and fire.
If
agree.
have general consensus, it'll start 6 o'clock tomorrow morning, because I totally concur with.
Can we get a copy of both from Chief Russell and Chief Keller, what your stage, your action plan is?
I guess
Jenny,
I'm
if
still
it's-
absolutely. I think Jenny has it, but I can send you updated because it also is a living document.
Right. Okay. Yeah, I concur with everybody else. I think we need to start that probably sooner than later.
Jenny, would it be
Russell,
okay if I shared my screen?
Oh, yeah. I don't know how you do that, but go ahead.
JT, is that okay? If I share the phase 3, you're still muted.
Chief, just make darn sure what's on your screen before you press share.
Okay.
While he's doing that, I would like to comment that somebody was making the comment that the employees, when they go home, they need to be available. And I've been really impressed and proud of public works staff, city hall staff, who someone went home Monday night being told they were non-essential, go home. And then as things continued to devolve last week, got phone calls that said, we need to make a bunch of signs. So please come in and print those signs. You'll be by yourself. You'll be isolated. And there's just been a really great spirit from the employees that have gotten called in to mow grass and the employees that have been called in to pick up computers so they can do building permits from home, that we've had a really good response from everyone. And I wanted to share that with you.
So on phase 3, we're making emergency responses only. That's basically covered in the next bullet that talks about, we're adding Charlie, Delta, and Echo, which we've talked about. I'm canceling all staff vacations. We don't have any that are on the books. The guys know that it's coming, so they haven't asked for any vacations. They can't travel anyway. Something else that you need to know, the plan says no more than 1 unit sent on mutual or an automatic aid calls. I probably should have worded that different, and I'll make it more accurate to say 1 unit plus a supervisor. So a real world example of how that changes is if Rose Hill gets a structure fire in the north end of their district right now, they're going to get an engine, a tanker, and a chief. With this, we would only send the engine. So that's a change, certainly from what, but it would be within the automatic aid agreement that we have with them. So you're still within the legal agreement. Consider changing daily duties to assure adequate rest. We're not going to be changing any duties. That is based on you have so much absenteeism that you have people working multiple days. So you need to think about how they're getting their rest. We anticipate that as this continues, we're going to start getting less help with mutual and automatic aid, just like we're sending less help. So we've worked with the dispatch agencies to be able to make sure that we're getting adequate help. And then it changes your daily staffing. I would not recommend making this change right now, but if we were to have to, we could go from 5 to 3 per day. That is a drastic change from where you are today, and I would not suggest that. My recommendation to you, I hear you say that you're in support of the plan. My recommendation to you would be to leave us responding to the Alpha and Bravo calls for now, and maybe let Jenny and I discuss, and the mayor obviously discuss on a daily basis where we are. And I would really anticipate probably pulling the trigger on this within the next week. But your firefighters making those Alpha and Bravo calls are very important to our community, and I don't want to remove that service until we have to.
Anybody else? All right. Chief Keller, I'm very much in favor of what you talked about, and tomorrow would be great, and yesterday would have been better, so I like it. If everyone agrees, then we'll do what you do best. And
Thank you, sir. And I will tell you this, we will still provide all essential law enforcement services. We have this.
and Chief Russell, I like your plan as well. Just keep us up to date, and you're the expert in this. Just let us know what's going on, and any way we can support either one of you. We're there for you. Council, administration, everybody is there for the police and fire. Very essential to our being able to sleep at peace, and we appreciate that. I mean that from the bottom of my heart.
Thank you, Mr. Mayor.
The last thing, Mr. Mayor, on this item, I really didn't want to approve a change in policy per se, but just ask if generally there was support for a little bit more, I'm calling it compassion, of your utility billing staff when it comes to assessing late fees. We don't know how this is going to go, and maybe everyone pays on time, no problem. I talked to JT earlier about, should we do a policy that says there's no late fees for the duration of the pandemic? And he pointed out wisely that, if you do that, you somewhat have just given the green light for anyone who is able to go ahead and make those payments on time to not do so. And certainly the league director, League of Kansas Municipalities, used a really good analogy last week on a call that said they're going to encourage cities, like there's some cities in the state who are really small cities who are spending a lot of money, thousands of dollars, to buy gift cards to local businesses and give them away to citizens to try to spur economic development and growth. And that sounds great. But what he said was, I would encourage you, like they do on the airplane, to put your mask on first and then put your child's mask on, because if you're not able to conduct your business, you're not able to help anybody else. And so I thought JT's words were kind of timely with that same analogy, that obviously we don't want to make it a green light that those who can pay on time don't, but maybe just a little ounce of compassion for maybe first time or very rarely late utility bills, that maybe those late fees don't get applied across the board. Anybody feel strongly that no, if they're late, they have to have the late fee?
No, I think we should definitely give a little grace on that. We don't know how it's going to affect our residents or how that's going to turn out for them. So I think being kind in that regard. And I think there was something that said that we don't track those as part of the revenue, so it doesn't really affect the bottom line anyway for us. So I think it's just a nice thing to do for people right now when we don't really know the effect it's going to have yet on our residents.
Since the beginning of time, when Americans have tried to do something good for the people as a whole, there are always a small portion to take advantage of it. So you can't as far as what I'm trying to say, and not very articulately, is there are people that need it, and yes, there's going to be people that take advantage of it. But if people need help, then it's not going to make us or break us as a city by extending a hand. But that's just my opinion.
And then with the information you got earlier from the Board of Health on the request for the blood drive, is that something that you feel like we should go ahead and say, there's a lot out there right now, we're not going to open a city facility, or it's the Red Cross and the Red Cross can do it safely?
In my opinion, I think that if it's not a Red Cross event, considering that's what they do, and there are so many, as they had stated, already being done, I don't feel comfortable with just some random person holding a blood drive in the city and then us allowing it. I mean, if the Red Cross is doing it, yay. If not, then no.
They were going to, I think, try to make the reservation on behalf of the Red Cross. I don't know if that is common or not. This person,
just let the Red Cross do it. I mean,
yeah, I agree with Roy. Let's just let them run it, and there's plenty around. What they say, 4 or 5 in the next few weeks. Let them, unless it comes to that point, I don't think we need it right now.
So, and I know I said what I said, but I don't want to diminish the fact that we have a resident of our city who is trying to do an amazing thing for this pandemic that we're in, I just feel very scared, I guess, to have a blood event in our city when there's a pandemic going on and it's not being done by the official company, the Red Cross, that normally does that.
And that is what I want to clarify. I don't know, but I was kind of under the impression from talking to this woman that perhaps volunteers for them call and make reservations and then they handle all of the logistics. But she was trying to get a reservation for them in the city of Andover was how I took this, that she's a volunteer for the organization. I don't know that 100%, but that was definitely how the conversation went. And so I don't know if that changes thoughts at all or not.
It does to me. I mean, if it is an official Red Cross thing, then as I said, yeah, I guess I'm okay with that.
I think there's a lot of opportunity though around, so I would almost just wait and see, since they mentioned quite a few that are happening already. I don't know.
I know. I just got an invite from them via email saying that St. Vincent's is doing one on the 19th.
Okay.
And that was one thing I'd recommended to her. So maybe that's where she went and she got it taken care of.
So,
Okay.
So we're good. We're good on letting it, not doing it. Everybody, yes?
Yes. Homer says yes.
Okay,
I agree.
thank you, Homer.
Perhaps it would be nice, Ronnie, to reach out to her and thank her for what she's trying to do in this. I'm sure
Okay,
you were
yeah.
already thinking about doing that anyway, but if
Yes.
not, then that'd be nice.
I wouldn't. Thank you very much. I will though. I'm trying to reach out. Just so y'all know, I've been reaching out to small businesses and any business I can here in town to try to just say, hey, we're in this with you. I mean, I'm part of a new business that can't even open the doors. So I feel for them, and I've been trying to let them know that we're here for them, just like they're here for us when their doors are open. So any opportunity you get, if you see one of them, man, please just tell them, hey, we'll get through this. We always do. Maybe it's a chance to take a look at your business and retool while you have the time. Just encourage them to know that once this is over, that we are going to do everything we can as a city to help them once again get traction. I ran on small businesses. I'm partial to them, their family. So anything we can do to even encourage them, man, would be, to me, it'd be, we can't make promises, obviously, but we can say, hey, just like we're doing now, we're going to their businesses, we're eating out. Sherry and I are eating out more than we were before, just to keep them upbeat to the extent we can.
On that same vein, and since I think Mike had mentioned earlier, hey, are we getting this information? And I think on the SBA loans, and I think Jennifer had said that we shared it with Becky and such. Maybe it is something that we actively do as a city, is contact somehow every single business that's here and provide them that information somehow, whether it's walk it over to them or mail it to them or call them or whatever. It doesn't seem very difficult to do that.
Yeah, it's not. And I reached out to Timbuktu today just to let them know, hey, I care, and I don't want you to go anywhere, and don't give up, because really sometimes people just want to know you care, So maybe that's something we can work on as a council, or a couple of us can, I don't know, get it wordsmithed where we can send them. I know Becky Wolf with the Chamber of Commerce has a whole lot of email addresses, and we're doing that as a Freedom Hubs Therapeutic Writing Center. We're reaching out to some of our donors and telling them thank you, even though you can't donate now, it's because of tough times. We want you to know we still appreciate you, even though you can't help us. So there's things we can do. I mean, I like to encourage people to the extent I can, and I think council doing it would be huge. So,
yeah, I agree. I wonder if we could get the right wording from maybe Jennifer or JT or someone that is layman's terms, not necessarily legalese, that short and sweet, where to go. And I wouldn't mind if you gave me a list of businesses I could call and or email them to make sure that they get that information. And if we wanted to divvy it up, I'm not asking the rest of the council to do the same, but it would be pretty awesome if we had the opportunity to. Not everyone can make phone calls and talk to people, but I used to be a telemarketer and I made about 2 million calls, so I think I'll be okay with it.
I'm fine with that. I can help with that as well.
I would as well.
So I appreciate
I
all
would
your
as well.
I appreciate your enthusiasm. As you all are familiar, we do not have a business licensing process in the city of Andover. So I don't have a list of phone numbers per se of every business in town. I should be able through utility billing to be able to pull addresses at least. And so we can go with maybe a mailer approach, but I think the phone numbers are going to be a little bit tricky given the chamber gets a lot of your businesses, not all.
Right.
If you got names and addresses, though, we could just individually Google them to try to get the phone numbers. And if we can't get the phone number, then mail them or something.
Or even leave them a message so they maybe get it. Yeah, I mean, at the business.
Absolutely.
I mean,
But
also,
I'm not encouraging you guys to go against social distancing. I think that I'm hearing a lot of encouragement to go walk things into businesses and things like that. We are all abiding well by the state's order. And so there's ways we can use technology to get this information out.
Sorry, I don't know who said walking. I heard Troy say phone, telemarketing.
I heard walk it to them. So I was like,
Oh, sorry.
We'll make a comment on that.
well, I mean, also putting it on our webpage and our social media, and we can put it on our own individual social media as well. And I think that'll get it out to majority of the businesses.
Just so you know, the mayor did not sit in a lawn chair when he got his coffee this morning. Ain't that right, Chief? I think I seen Police Keller watching to see if I was going to sit down.
Yes, don't touch anything metal over there.
So Troy, thank you. And let's do what we can to the extent we can without getting ourselves in trouble. And just let them know that the city is here for them. It's not too much, and it's not heavy lifting on our part.
Hey, speaking of that, I just got a quick random question. And I don't know if JT can answer this or Chief Keller, but who is enforcing this state law or state rule or executive order or whatever we call it?
And how is more importantly.
Chief, you want to take that?
Yeah, I'll take it.
Gunpoint.
Actually, that burden falls on all law enforcement across the state to enforce the health department's laws or orders, as well as the governor's. So we're tasked with that. We put out a video this afternoon letting our community know of what our approach is going to be. We have instructed all of our officers to take an educational or informational approach, not an enforcement approach. Warnings will be the go-to response on all cases. I can tell you as of this evening, we had 2 telephone calls to our 911 regarding questions about the order, the governor's order, which is a lot less than I expected. And we had only one incident where we had to take any kind of action, and that was at the 13th Street playground. I guess the fencing that was put around the playground on 13th Street wasn't enough. We had a gentleman who lifted his daughter over the fence and allowed her to play in the playground. Once we explained to him, the officer saw it and contacted, and once we explained to him, he totally understood and took his daughter out of there. But that is it as far as any type of response that we've had to do today as of about 6 o'clock this evening. So our very that's going to be our approach. We are constantly contacting the governor's information email address, asking about questions of what businesses can be open, what can't, those kind of questions. I think we have a fairly good understanding of what the governor's order says and who can be open and can't. We keep going to them and trying to get responses so that we're positive we're accurate in our understandings.
I realize that. I'm sorry.
HOA playgrounds, what we should do with HOA playground?
I'm sorry, sir?
The HOA playground what we should do about those?
I think that's going to be up to your own individual neighborhoods. The concern the city had in our discussion with the mayor and Councilmember Tabor yesterday was about the concern of the spread of the virus lingering on the equipment, and they thought it would be in the best interest if we closed the playground portions. But the parks are open, and people are encouraged to get outside as long as they stay, governor's order, as long as they stay in groups smaller than 10 and they social distance to minimum 6 feet.
Okay, thank you.
Did we get signs on them yet? Do you know, Lance or Jenny? Not that they'll help, but they can't hurt.
They put those out this afternoon, I do believe. Correct, Lance?
Okay. And by the way, I got
signs have been installed.
No, it's not. No. And the person that did that would have done it with a sign on it, I'm quite certain, but that's here and there. But at least we can say we did our due diligence to the extent we can. And I got an email today. A gentleman's worried about the 6-foot rule on the golf course, and I forwarded that to Jenny and let him know that, you know, we're doing what we can do, but it's hard. Can't remember how many acres that is, but they can't police the whole thing while people are out playing golf. So there's only so much we can do as a city.
They had adopted, we talked about that yesterday, pretty strict rules. They actually emailed it out to all of their members, I believe Friday, 1 per cart, no lingering in the clubhouse. And Randy had told me, I mean, they don't serve food. It's not really a country club atmosphere. They serve like a bag of chips and a bottle of pop, but people take that in golf. They don't like sit there and eat a meal like they might at a country club setting. So he had said they'd had no problems having 4 or less people in the clubhouse at any given time, that they had been sanitizing nonstop every handle in the clubhouse. They sanitize the carts after they're used. He indicated it smells like Clorox at the golf course right now because of the combination of bleach mixture they're using to wipe everything down, but that they have had a lot of usage because people trying to get outside.
To their credit, they reached out to us, didn't they?
Yes, they've reached out a few times to ask if we are still comfortable with them open. They've been really great about it. If at any point we're not, tell them, but that they are. And so with these measures, they felt like they were still in compliance with the governor's order. And those of us that were on the Zoom call yesterday, a couple staff, and then Councilman Tabor and Mayor felt like, yes, they were in the spirit of that order as well.
Greg, does your community have the what they need or the means to fence off the playground?
I can come up with something. I don't have any equipment right now to do it.
Okay.
So we'd have to probably go out and purchase that.
I might be able to help you with that. I'll let you know tomorrow.
Okay. Thanks.
What did the city just use T-post and the red caution fence, correct?
It's not red, it's black. At least the one here in Central Park is. But yeah, it's basically just a fence with T-posts.
It's the same product, right?
Yes.
Okay, thank you.
Yeah, I've got plenty of T-posts. It'd be the other stuff that I would need.
All right, I know somebody with some muscle that would be glad to help you.
Okay, thanks.
Troy, did you hear that? No, I'd be glad to help you, Greg. I'd love to.
Yeah, I said I did hear it, but I didn't know you were talking about me. But I got gun show over that way.
Roy's still Googling T-post.
It could be nefarious, but I'm pretty sure I know. No, I'm kidding. I know what a T-post.
Oh, it's good to laugh, isn't it? It's good to laugh in these times. So anything else we're leaving out or we need to do?
Chief Keller or Chief Russell, do you guys, on the mask situation, do you guys want any more? And or, I don't want to say, hey, I've got some, but if you did need some, how many would you want?
Muted yourself rather than unmuting, Chief.
Good catch. I'll go first this time. I would, I'm concerned after listening to Dr. Landers and her concerns. We only have enough, if we start using them every day of the N95s, we have enough to last about 3 days. We would use on an average 3, 6, with going to our staffing, we would use 6 a day. So do the math, we could easily 30 a week.
Okay.
So I would,
Yes.
if I could get, to get us through the next 8 weeks, 100, 150, stretch them out.
I mean, I guess I hesitate because even if you get that many, it's just like Mayor Price said, you still have to worry about going into those homes that are already probably most likely contaminated. And what are you going to do when you leave them, I guess. But I'll see what I can do on getting some masks for you guys. What about sanitizer? Are you guys doing any kind of sanitizing? As far as, I know, Chief Russell, you do decontamination. Chief Keller, are the police officers using their gloves and stuff like that? And then are they wiping their gloves down if they reuse them?
We never reuse our gloves. We have a supply, and we ordered a year's supply last, I believe, October, November, and we turned around and ordered another year. So we ordered our 2020 supply beginning of this year. So we're sitting on a great number of gloves. We also purchased about a month or so ago, we purchased a bunch of disinfectant. We have about 8 gallons of that in the office, along with the sprays. We have the sprays in all the cars. They're wiping their cars down every shift. We are sitting good. All the officers have eyeglass protection available in their cars. We're sitting good with the exception of the masks.
Okay.
And Councilman Henry, if I could, I'll just get a hold of you. We're definitely interested in masks. We're at our burn rate. We're going to be out and we're going to be in air packs. And I don't think that's a good place for us to be.
No.
We could keep your firefighters safe by doing it, but I don't want to run medical calls in air packs.
Okay.
I'll get with you.
All right. Where we at? Everybody happy? Any discussions? Any questions? All right.
I would like to mention that we've had 93 people visit our portal today that don't have an Andover KS email address. And that's come down from when the packet was published on Friday. There was like 130 people that visited the portal on Friday. Again, those are people. So if you guys are not using your Andover KS address, it's going to tag you as being somebody that's outside of our group. But that's quite a few. And I went ahead, Mayor Price, and changed it on the website to tell people that they could email up to anytime prior to the meeting. Or they could email me anyway prior to the meeting. I didn't say anything about the rest of the staff, but since I'm talking about
and we have to keep in mind that we have a whole lot of people that consider themselves Andover residents that are not. So Sedgwick County tag doesn't necessarily mean that they're not part of our community.
Right.
So it's just something to keep in the back of your mind when we think about, like I said, a lot of our schools are full of Sedgwick County students, and those folks are hardcore Andover people. And I argue with them all the time. I live in Andover. I tell them, no, you don't. 159th Street on the west side is not, but I'm just joking with them, and they consider this home. In fact, two of the guys I have coffee with on a regular basis are Sedgwick County, but you'll never convince them that they're not Andover citizens, nor would I want to. So it's just a thought that I'd like us all to keep in mind. At the end of the day, we're all in this together. All right. So can I get shall we adjourn?
I will need a motion by somebody to do that.
A motion to. Second. Do I have there you go. Thank you. Tim seconded it. All in favor, say aye.
Homer says aye. Okay. We all say
Aye.
aye.
Yeah, all opposed? Stop it. All right, thank y'all. Be
Thank
safe.
you.
Be safe. Stay home.
Thank you.
Thank you.
Thank you.
Homer, I love your earmuffs.